Hello everyone. Today we are going to tell you about the behavior of nursing students in the clinical settings. The very first thing a student nurse should do is self preparation. There are certain steps a student nurse should follow for self preparation before going to clinical duty. Step 1. Dressing up yourself with complete uniform. Clean and iron dress with apron. ID card with name plate. Wristwatch. Black shoes with white socks. Trimmed nails. For girls, hair bun with net. No colorful accessories. No jewelry and no makeup. For boys, short haircut. Clean shave. Step 2. Carry pocket articles. Student nurse must carry the pocket articles in their apron's pocket. Nurse's dictionary, stethoscope, pocket diary, pen torch, thermometer, inch tape, nail cutter, scissor, small scale, red, blue and black pen, pencil and eraser, small sanitizer. Step 3. Carry article bag. A separate bag with articles must be carried by a student nurse to ease the demonstration and presentation of nursing procedure. Medium tray, injection tray with lid, kidney tray, 2 small bowl, surgical scissor, artery forceps, thumb forceps, a pair of surgical gloves, mask, cap and shoe cover. Step 4. Procedure checklist. To perform any nursing procedure, student should carry the checklist in hard copy. So checklist of basic procedure such as vital signs, health assessment, bed making, back care, oxygen therapy, nebulization, nasogastric tube feeding, etc. must be kept in bag. Lastly, carry daily diary and should know the writing format of it. Students will reach to assigned ward at on scheduled time and will perform hand washing following all the steps and wear personal protective equipment such as gloves, mask, shoe cover, etc. Students will go to the patient's area and clean the unit by managing the side locker and performing the bed making. Students will interact with the patient and collect the history and prioritize the needs. Clinical instructor will visit to the ward.
Good morning, ma'am.
Good morning. Tell me about your patient.
Ma'am, myself Nikki Sharma, a student of BSc Nursing second year. My patient name is Mr. X and he is 43 years old and he belongs to Lucknow, Uttar Pradesh. Patient is admitted on January 2 to General Medicine ward with the chief complaints of generalized weakness for 6 months, nausea for 3 months and breathlessness for 5 days under the consultation of Dr. A and diagnosed as severe anemia. The patient's present medical history is the symptoms were arising from past 6 months when patient starts feeling congested followed by nausea. Patient then got admitted to local hospital and diagnosed as anemic. Then he got referred to KGMU hospital. Patient is not having any present surgical history. Patient is having past medical history of diabetes mellitus for 5 years and had no past surgery.
What are the current vitals of the patient?
Ma'am, the patient's current vitals are normal temperature, that is 98.2 degree Fahrenheit with reduced pulse, respiration rate and blood pressure which are 68 beats per minute, 12 breaths per minute and 100 by 60 mmHg respectively, and oxygen saturation is found normal. Patient's skin look pale with whitish nail.
Tell me what are the findings of investigations?
Ma'am, the findings of investigation shows that hemoglobin level is reduced to 7.5 gram per dl, MCH level is reduced to 9.4 gram per d, erythrocyte sedimentation rate is reduced to 9 mm per hour and serum ferritin is reduced to 2 ng per ml and rest counts are normal. Ma'am, and the treatment patient undergoing is injection iron dextran 50 mg IV BD, injection ferrous gluconate 25 mg IM TID, injection sucrose 20 mg IV BD.
What priority needs you have identified for this patient?
Ma'am, the priority needs of patient for today is management of breathlessness, nausea and weakness, and effective health education could be on the topics of breathing exercise and frequent monitoring, and health education on iron rich diet and maintenance of personal hygiene. Thank you, ma'am.
Okay, beta.
After history explanation, teacher gives clinical teaching.
Good morning, students. Today we are going to see a demonstration on PPE, that is personal protective equipments. When you are going to start a demonstration, first you have to gather all the articles or equipments as required and do your hand washing as per the WHO guidelines via using a alcohol based hand scrub or hand rub.
After procedure, replace the articles in utility room and send them for sterilization or put in the SIDEX solution with the coordination of ward in charge. Students will do the remaining work of the ward under the guidance of ward staff till the completion of assigned duty hours and will leave the ward after taking the signature of ward in charge.